What's up, beautiful people? This is your girl, of course, Nadia Mukami, the African pop star and the brand ambassador of RFH and Redleaf Medical. So I'm here today with Paul Okoth. Why did I introduce him? I should have left him to introduce himself. Of course, the CEO of Redleaf Medical. And today it's an amazing day because I have been talking about Redleaf Medical on my social media platforms together with Arbo, and I felt like, you know what, it's time I get information from the horse's mouth. What if there's something that I'm not saying correctly? So today he's here to advise us, to correct us, and tell us more about Redleaf Medical. And of course, make some noise. Give me the drum roll, director. Paul Okoth of Redleaf Medical. Karibu sana.
Asante, I think
Uko
that's
poa?
niko salama.
Yes, mi niko poa. So leo nimesema I need to come and get information from you. Sindio?
Okay.
Tell me about Redleaf. Why Redleaf? The name, when did you guys start and stuff like that?
Okay. Well, Redleaf, or if you look at the emblem we use,
Yes.
it's actually an extension of our logo as RFH Healthcare.
Okay.
Usually like a red thing you see there. So that informed the name, actually.
Okay.
There's nothing deep to it.
Okay.
I think I wish I could make something up right now.
And
but
creative and
it's just
stuff.
that.
Yeah.
But the idea behind it is actually very thoughtful.
Okay.
We realized RFH was here building hospitals all over.
Okay.
And we want to advance care, we want to do all these premium services, but
Yeah.
well, we realized we're building these premium hospitals, but
Okay.
people are not able to afford them.
Okay.
So part of it also, you wonder, then what is the end game? Because
Okay.
when you have a bed, you have a doctor already in the hospital, but nobody can afford the services you offer.
Yeah,
It's pointless.
Nothing, yeah. True.
So we looked at the solutions we have in the market today. Of course, there are institutions like the NHIF that have done tremendously well for Kenyans.
Yeah.
Then you look at the private insurances, but with each, there are limitations they have.
Yeah.
So Redleaf comes in between there as
Okay.
a membership plan. Actually, we're not an insurance company,
All right.
but we offer members a chance for
Okay.
them to be able to afford these services at RFH.
Yeah. Just before you continue, let me just stop you there.
Okay.
When was Redleaf born?
Redleaf is 2 years into existence.
All right.
I think started in 2020.
Yeah.
We've done 2 years now. We're taking care of about 2,000 families currently,
Okay. Wow.
and still growing.
Okay.
And we noticed people just started believing. As the moment you just tell them the actual point of it and they see the sense in what we do,
Okay.
they always sign up.
All
and
right.
we have had people take us right from day one, even before we had a logo. Yeah.
That's really nice.
Okay.
Knowing that you guys have over 2,000 members already. So how does Redleaf work, and what are the benefits of, me being part of Redleaf?
Okay. Look at Redleaf like an exclusive membership.
All right.
Where you come in, we know you as a person. I think people like saying we do this for celebs. No,
No,
everyone will come in as a celeb.
Yes.
You come in as Nadia, we accept you,
Okay.
and then we assign you what we call them like your health PA,
Okay.
personal assistant.
Okay.
Where anytime you need any medical attention, first of all, we encourage our members to call us.
Okay.
Tell us you're coming to hospital. We arrange for your visit before you even get here.
Okay.
Then once you're here, we make the process very seamless for you.
Okay.
But once you're a member of Redleaf also, you forget about the bills.
Okay.
We give you an allocation. You manage it for your family for a whole year
Okay.
at a fraction of what you'll get in the market.
Okay.
Yes.
That's really interesting. So one of the things that you said that has really interested my ear was you first have to call so that it can be arranged. Why do we have to call or something?
Well, not really. You don't have to call. Actually, sometimes you can go into any hospital without us knowing. We give you a membership card. You walk in, you just put your fingerprint and you can go. But we understand people move it. We're in a fast-paced environment.
Yeah.
Sometimes if you don't want to spend so long in a hospital,
Yeah.
you want to be received by the time you're getting here.
Yeah.
It helps sometimes to know, okay, it's Nadia coming with the baby, it's
Yeah.
Nadia coming with this, so we start arranging
Yeah.
way before you get here, just to make your process quick. But in the event you also just want to pop in from anywhere, you're free to do that.
All right. So let's say I have called, I'm a new member.
Okay.
I've not yet signed up. I have called the office. Hi, my name is Nadia Mukami. I'd like to sign up. So take me through the process of me as a new member who's not yet joined,
All right.
wanting to join that, that Redleaf Medical plan.
Well, our sign-up process is very simple.
All right.
Unlike the typical insurance plans that are out there, we won't subject you to a medical
Yeah.
evaluation.
Yeah.
All we need from you are details of your family.
Okay.
You declare for us, these are the members that we want to insure, we want to enroll in the plan.
Okay.
And then from there, we work out a quote for you. We have different bands, and our quotes are adjustable per family.
Okay.
Even the limits that we set are not cast in stone. Some
Okay.
members will want to extend them. Someone
Okay.
will tell you 50K for a patient, it's small for me, I want 100. Then we readjust that for you.
Okay.
So once we agree on a quote, just by a phone call, we can fill the form for you. Then we scan it back. You read the terms and conditions.
Okay.
Then if you're okay with them, you can sign digitally. Then that's it.
You send back.
Yeah.
You've talked about Redleaf covering family members and stuff. Let's say I have adopted children, I have my friends in a chama, or I just have I have a business, for instance, my Seventh Creative Hub. I want to cover them medically. Is that possible, or how do I do that?
It is possible. Like I told you, we are not the typical insurance kind of plan. For us, we accept as long as you're 2 adults in that group, per family that is.
Okay.
You tell me you're 2 adults, you don't have to be nuclear family. You can bring in the people you're taking care of, as long as they're your dependents, and you declare them from day one. That's okay. If you want to enroll your company, like you say, we also have plans for groups, companies. I think the biggest currently we do, I won't mention, but we have big companies as well as part of those members that we currently take care of.
Yeah.
Yes. So it's possible for either.
So I got information somewhere that if I bring, like, it's more of a corporate deal, I get a certain percentage. Let's say I have my chama. Do I get a discount, or is my information wrong? Let's say niko na chama yangu ama niko na watu wa busy yangu or something.
Well, we wouldn't call it there's a group discount that is applicable. When you come as a group, always there is that I'd call it bargaining power that you come with. So for us also, we extend that group discount. When you come in numbers, there's a formula we have that works it out for you. And it's actually more affordable when you're in groups. Yeah.
So just to clarify for anyone who's saying this, the group is, what's the minimum of a group? And is there a maximum? Because there's a watu wawili tusimasini group ama tuko watatu.
For group has to be 5 families and above. Yes. This we do for chamas and even friends just come together and say we are 5 families who want to come in. Yes.
So you guys, you've had, you can get your squad, you can get your chama, you can get your business, guys. Let's say unataka ku secure the people who work for you. Redleaf Medical Plan is the place to be. So moving on swiftly, there's something I want to ask that is, I think, came up from my Insta stories. Does it cover chronic diseases?
Well, the issue of chronic illnesses is a bit thorny for these kind of medical plans or insurance that we run.
All right.
So the simple answer is no. We don't cover pre-existing chronic illnesses. But in the event we discover you actually have these chronic illnesses in the course of your membership, we'll just take care of you for it. The reason why we don't cover pre-existing is just to avoid basically people abusing this. Where someone knows they already have an expense every month for this, but you want to come and push it on to Redleaf. Partly because managing chronic illnesses requires constant medication, and this is something that can last even a lifetime. So it's hard to price for it. So currently we've still excluded that, but we're working on it. We were trying to see how best to accommodate those who already have these chronic illnesses. There's
something that he's said that I really like, that they do not cover pre-existing. But let's say you have the medical plan, the medical cover, and you happen to develop a chronic disease, they take it up from there. So I think that's very, very vital. That's why you need to get Redleaf, So hapo kwa covering, what we cover and what we do not cover. Tuko kwa time of COVID. Do we cover COVID? Because I don't want to call COVID a chronic disease, but it's,
Absolutely. Absolutely. At the peak of COVID, I think it was the 3rd wave, we already had members on Redleaf, and we cover it all through. Yes. We were among the first, I think I would call the first hospitals around to admit COVID patients when it broke in March of
Okay.
2020. Yes. So it's not, we don't fear COVID, and we actually cover it.
So
Yeah.
just to take care of yourself, you need to get this cover because tuko kwa najua imeenda chini but we're still in the pandemic somehow. So the other thing is, let's say I'm going to use myself as an example, right? I do not have enough money to cover for myself and my family. So can I be able to pay in installments, and what's the plan in terms of installments?
Okay. Plans like we do are typically cash and carry.
Okay.
But for us, we want to be a bit flexible to people.
Okay.
Realize if you want to appeal to the same population that can't afford private insurance,
Okay.
asking them to chuck 35K, for instance, at once can be a bit hard or strenuous for them. So we allow up to 3 installments. The only difference is in the event that you need to be admitted,
Okay.
we'll require you to complete your premium. Yes.
Okay. That's a very good pointer to note. And what is the age limit and maybe the minimum age? Do we have a scenario of that?
Okay. We only have minimum entry age.
Okay.
Yeah. The minimum you can join Redleaf at the moment, we've set at 55 years of age.
Okay.
But once you're a member, we take care of you for lifetime. Yes.
So let's say my dad just retired. He's 65. So he can't be part of Redleaf.
At the moment, no.
Okay.
Again, that's part of the conversation I told you we're working on for chronic illnesses.
Okay.
Yeah. This again typically is because by the time someone is age 60, chances are they're probably dealing with 1 or 2 issues which are chronically ill. So we also don't want to missell. We tell people we'll take care of you, then tomorrow we start making stories. You know? So it's easier to just tell them outright. At this point, we're still not able to take care of you if you're over 60. Yes.
Okay. Then the other thing is, let's say now that on the issue of age limit, let's say a client was part of you, then they attain the age limit. Do they terminate? Is the cover invalid, or what happens?
No. We take care of you for life. The minimum age of entry, like I'd call it the oldest you can join Redleaf is 55 years. But once you're a member of Redleaf, it runs for life.
Okay.
Yeah.
So let's say there's the surgical cases that are covered in the in the policy document, the one that you send to guys and they sign or they ask questions. Are there other cases that are beside that, the surgical cases there?
If you look at I'd call it the subclasses that we cover, basically cover, I'd say 99% of things that would come up on a day-to-day basis. Yeah, from outpatient to those specialized surgeries. I think we keep saying that the only surgery that we're not able to perform currently is an open heart surgery, but that is because we don't have a cath lab as RFH yet. But in the event one of our members need that, now it becomes our cost to organize for that to be done.
Now that was
partners.
My next question. Do we have overseas treatment? Can Redleaf cover, because you've said, let's say there's the open heart, and let's say we are not in a place where we can do that. Can Redleaf arrange for the patient to be have the overseas treatment?
At the moment, no. Yes, we restrict our operations to the geographies of Kenya. And partly because we want to strengthen our systems. Truth is, currently, I'd say 100% of what we need is able to be done locally. Yesterday, we were just doing a presser that we did total hip replacement for ex-Harambee Stars players who have been fighting that for quite a long time. Less than a few years ago, people used to go all the way to India to get that done. Yet currently, we're doing them locally. Whatever we're not able to do here, I'm sure there's a facility somewhere
here locally,
and we have doctors who are trained that can take care of them.
So guys, just to remind you, these are the questions that were brought up via my Insta stories by most of you, because I did a Q&A. Tell me, or just ask me the questions that you love me to ask on Redleaf when I meet the Redleaf CEO. So on my next question is, what are the cover limits?
All right.
Please take us through that, because I think this is the most vital. This is it. Take us.
Well, our limits I'd say they're flexible, but currently the quickest way, so that we don't also bog people with a lot of information, where you don't want to read so many things, we just banded our packages. One that we work with is for a family of 3 members.
Okay.
This family of 3 members, we're just looking at the nuclear family of father, mother, and 1 child.
Me, Aro, and Kai.
For instance.
Yes.
But remember, like I told you, it doesn't have to be nuclear. Yes. So for this 35K, we cover you up to 50,000 for outpatient limit.
Okay.
We'll cover you up to 1.5 million for inpatient.
Okay.
We'll cover you for 100,000 for maternity.
Okay.
We'll cover you up to 30,000 for optical related issues, up to 30,000 for dental related issues.
Okay.
Of course, families are different. You'll find a family that is larger. So you say for each additional member, after the first 3, the member will top up 11K.
Okay.
From that, we also review the limits because we understand this family is bigger. Those limits now change.
Oh, okay.
For a family that is larger than 3, say from 4 onwards, we extend the outpatient limit to 100,000.
Okay.
That is like double.
Okay.
Because it's shared. These limits that I'm saying are shared for the family. And then the inpatient moves to 2 million for this larger family, also shared.
Yeah.
Maternity, because we expect only 1 case, that remains at 100K for that. But they have to be specific. Maternity will only be 1 member in that plan.
Yeah. Okay.
Yeah.
So let's say I have twins.
So you
Or
have,
triplets.
no. The limit is on the mom.
Oh.
Yes. It's
Not
on
on
the
the
mo- not on-
kids.
yeah, not on the number of kids,
Okay.
yes.
I think
You have-
that's well in, because you've talked about, so let's say you've said it's for three members,
3
family
members.
members.
Yes.
Then with an addition of 1, you add 11,000.
You add 11,000.
So the more you continue adding, you just keep
Yes,
adding.
just keep adding
All
that.
right. So I hope you guys have heard that, and especially on the maternity issue. Tell me about maternity, because let's say when a woman gets pregnant, can they get the Redleaf cover, or they have to wait till they deliver, or is there a special arrangement that is made? Tell me about that.
Okay. Once in the event that you're already expecting,
Yeah.
at the moment we don't cover your pregnancy.
Yeah.
Again, that would fall under the pre-existing kind of conditions that we're talking about.
Yeah.
Yeah. Remember, pregnancy is not a disease,
Yeah.
but it's already there.
Yeah.
So we already know it's there. Just to again deter people from just coming into Redleaf when they already know the kind of expenses they're expecting.
Yeah.
So we encourage members out there, you're trying for a baby, it's not here yet, just this is the time to now pick Redleaf before it gets there. But in the event that already expecting, we also work with RFH hand in hand, and we have RFH branches that accept comprehensive delivery through NHIF, for instance. So members who would like to deliver in RFH and they did not plan for this, we still tell them to consider using an NHIF for their delivery, because NHIF is there
And
and they're
also the
very
Baraka
flexible.
card.
And even Baraka card as well, where, because again, NHIF would have limits to what they'd want to do, for instance. But in the event you want extra, you want private wards, you want to come and say deliver in a presidential suite, we still let you do monthly contributions for that, and that we do through Baraka card.
Okay.
Yes.
I think that's well in. So dear ladies and dear families, especially if you're a small family and you've not yet had a child, I don't think there's any plan, even in insurance, that caters for women who are already pregnant. So for you, kujipanga mapema, make sure you get your medical plan, which is the Redleaf plan. All right? So that when you are pregnant, that liability inaweza tolewa, si eti mtoto ni liability, but that, the expenses and stuff, because maternity sometimes it's not a joke. You can have the situations of CS na pia normal na ujajipanga. So make sure you get your Redleaf medical plan. So on to my next question. What are the waiting period? Like, what is the waiting period? For how long? Let's say nime apply leo, how long do I need to get the outpatient, to get the inpatient?
All right. For outpatient, we start immediately.
Yeah.
For inpatient, we have a 30-day waiting period for non-accidental admission.
No, okay.
Remember, I have
That
to
was
say
my
that,
next
yes,
question. Yeah.
in the event it's an accident, we'll take care of you, once you remember, you remember.
Yeah.
But for non-accidental admissions, we wait for 30 days.
Okay.
Again, just part of precaution again, just to make sure that you're not coming in with already a patient who is admitted in another center.
Yeah.
So we put that 30-day waiting period just as a precaution.
And I think that there makes Redleaf unique, because most covers always have 30 days even for outpatient.
Even for outpatient, yeah.
So I think having the 24 hours and the 30-day, the 24 hours is for outpatient and the 30 days is for inpatient. So kindly note that. Most policies have 30 days for each and every one of them. So I really like that about that. So what if I have another insurance cover? Can I still apply?
There's no reason why you shouldn't.
Okay.
Again, we keep saying that we're not competing whatever is out there.
Okay.
We are here to complement.
Okay.
Yes. Remember, we are very flexible in our limits or the kind of exclusions that are set.
Okay.
We try to go over and above what typical plans out there have.
Okay.
Yes. So it's in your best interest to also have Redleaf, even if you have a plan already, so that we help you even in those areas that they could be excluding.
Okay.
Yeah.
So I know of other guys who always have, if you're with us, let's say it's insurance X, and you'd like to join another place, we'll have to call insurance X for us to confirm. So do we have a scenario like that, or for Redleaf, it's you just come in, we'll give you our plan and stuff like that?
No. We are not even trying to compare ourselves.
Yeah.
You want to come to Redleaf, you come with all that you have. Yes, we'll take care of you.
So you guys, I hope you've had, if you're already in another cover, you can as well get the Redleaf medical cover. So I think, my God, this is amazing. The medical plan is amazing. Mimi ni member. Je wewe. Okay, that's just a line I came up with. I went to ask about the insurance and emergencies, and I think you've already answered that. So let's talk about, unajua, sometimes Wakenya mabinadamu tu ni wale default payment. Let's say I have defaulted.
Yeah.
What happens? Do I still get covered in the scenario there's an emergency, like, accident na vitu kama hizo? And also talk about ambulances, because people tend to misuse ambulance. So is it part of the deal?
Okay. Well, we work purely on the principle of utmost good faith. Remember, when I started, I told you we don't even subject our members to pre-onboarding exam.
Yeah.
Hoping that you're also honest Kenyans who are looking for a solution.
Yeah.
So when you come on board and for whatever reason you're not able to pay your premiums, that will take it as a breach of contract or a breach of the faith that we also give you. And we have no option but to terminate the arrangement.
Yeah.
So in the event, say you defaulted and you're coming in after 9 months, that with an emergency, we'll be right to say, sorry, you didn't go as per our plan.
Okay.
Yes, but we hope we don't get there.
So let's say pia nimechelewa like 3 months. Let's say I was paying in installments.
Yeah.
Na nimechelewa 3 months. Pia mtapiga simu kutukumbusha?
Yes, we do try. Before we give up on you, actually, we try.
Okay.
And we don't harass people on this, just because we also understand that the need for installment payment is just for flexible kind of way. So we always send reminders, and we'll also gently just nudge you to keep up, because just to avoid the inconvenience, because like I told you, when you need to be admitted, we require you to have cleared your premium. So it can come when uko pabaya. So it's in your best interest that you also clear this before then.
Okay.
Yeah.
I think you guys have heard about that, because most of the time unapata Kenya, you pay 1 month ama 1 installment, then you default, then you come back after a month and you still want no. So when you get a call or you get a reminder, please make sure you act on it. But I trust you guys, because I know you're going to be diligent in paying, and you're going to be diligent with getting yourself this amazing, medical plan. So tukikuja hapo kwa medical plan, is it exclusive to RFH? Because this is the most asked question. Or you can use it in another place. And if it's exclusive, why don't you guys want to venture into other places?
Okay. currently we are limited to RFH healthcare because that is the hospital that we find very easy to work with.
Yeah.
But we have plans also to open it up for
Okay.
other members because we keep getting these requests. Remember, whenever you're starting something, you start small, start where you are. We started with Nairobi because that is where we are. But
Okay.
currently we're getting requests even beyond Nairobi.
Okay. Yeah.
We're in talks with hospitals outside just to see which strategic towns we can partner with.
Okay.
And once the arrangements are ready, we'll let Kenyans know
Yeah,
that
okay.
we're okay. But currently we're just limited to RFH healthcare.
Yeah.
Yeah.
So guys, that is the most asked question. Redleaf medical plan is only available right now, as of now, RFH,
But I must say, RFH has 8 different branches across Nairobi.
yes.
So if you stay in Nairobi, chances are we are very few kilometers from where you stay.
Yeah.
We tend to go where most people reside.
Okay.
If you go to Embakasi, we're there to take care of people using Mombasa Road.
Yeah.
If you go to Ruaka and the sides for Westlands,
Okay.
yes, we have a branch there.
Okay.
If you use Thika Road, we are in Kawa West, somewhere in Jacaranda Gardens.
Yes.
If you use Kangundo Road, Eastlands, we are in Komarok for you. Again, we're in Ruai, and there's a branch in Tala for people around Machakos.
Okay.
Yes.
And kwa mama si tunapatikana pia Tala, so make sure you get your cover. I think this is my second last question. So nimekuja with my 35k. Nime read the terms and conditions. I've been taken through the plan and stuff.
Okay.
I have agreed to the terms and conditions. I have signed. Let's say I want the inpatient and the outpatient. Nimeambiwa sasa ningoje hizo 30 days for the inpatient and the 24 hours for outpatient. So will I be accessing it via, nitakuwa napiga simu ama nitapewa card ama nitakuwa naeka kidole? How does it go? Because so many people have different ways ya kutumia.
Yeah. Oh, yeah. No. Once you remember and once you sign up,
Okay.
we process your cards almost immediately. But in the event your card is not ready, when you come to either of our receptions and you tell us you're a member of Redleaf, they know at the back, they know how to verify your details
Okay.
for you. So you just get treatment and you go home. But once you have a card, once it's ready, you will come in. The first visit, you register your fingerprints. Again, this, I have to say that you have to be honest from day one.
Yeah.
That the people you declare are the people you'll use forever. Because once we register your fingerprints, you can't change.
Yeah.
Yes. And just to avoid locking you up later when you come for treatment,
Yeah.
you come with your card. That is your identity.
Okay. So let's say I am Ogechuku Janet.
Okay.
I have moved from Nigeria. I'm coming here to work for 2 years. And so can a foreigner also get the card for the two, or is it strictly for, does it, have nationality issues? Nimekuja kufanya kazi and I need something to take care of me while I'm here.
All right. If you're a foreigner and you're in Kenya legally,
Yeah.
we will take
Very
care
vital.
of you. Yes,
Yeah.
we don't want to be a bit crime. But
Yeah.
once you're here legally, we take care of you. We don't discriminate, and we can actually adjust your periods. If you're here, say for 6 months, we can give you the plan for those 6 months that you're here. If you're here for longer, even better. Yes.
Okay. I think that was a very, very vital question. And thank you guys for your amazing, amazing questions, because I think I've also, corrected some of the things maybe I didn't have a glitch on. So, yes, I'm going to tell Paul to tell us what does he think that Hatuja cover now, because I think this is the questions that my fans and everyone asked me on my Insta stories. So,
Okay.
wewe unaona nini sija cover, so that you give them now the final words.
Well, it was quite comprehensive.
Yeah.
I'm trying to see
Anything in it. So before I let Paul go, because his time is money, he's a busy guy, so I want to ask him. So most people always ask, I have my NHIF, why do I need the Redleaf medical plan?
Okay.
Tell me.
Well, when I started, I told you we're not here, say, to compete
Yeah.
the other plans that are already there. But over time we noticed each plan, as good as it may be, it has its own limitations.
Yeah.
Speaking on behalf of NHIF, we actually encourage members to have NHIF. Reason being, this strengthens the institutions that we have as a country.
Okay.
NHIF is it's like a social protection plan also. Remember, when you contribute, it's not just for you, but it's also for other Kenyans who are not able to afford this. So we are the first advocates to encourage members to actually have or sign up for NHIF.
Okay.
Partly because where they're strong, NHIF also does come through for people in very different ways.
Yeah.
For instance, dialysis, they've done so well. Surgical procedures, the procedures they actually cover comprehensively.
Okay.
But again, there are areas that it can be worked better.
Yeah.
For instance, your outpatient side of it, where you may have a bit of limitation in some hospitals. I'm not saying we do that, but the places you would go, you'd be told, this counter is for NHIF, or these are just for the members who, so they give primary cover. But when you need something extra, like you want to see a gynecologist, then you have to be referred to specific centers, So Redleaf is here to complement that. Those shortfalls that tend to exist because of some of these plans that are there, that's what we're here for.
Yeah, I think it's the keyword is covering the loopholes that have been left by NHIF. So I think that's very, very vital, because you guys ask that a lot. So maybe any last remarks, anywhere you feel we haven't talked about and you want to share with the rest of the guys?
Well, the only other concern I think that you've not covered.
Yeah.
Remember, we said we are in Nairobi only.
Yeah.
But we understand people travel a lot, people move around.
Yeah.
That does not mean that when you leave Nairobi, your cover ends there.
Yeah.
In the event you were to fall sick, you're a member of Redleaf, you fall ill out of Nairobi, we normally require you to inform us within 24 hours of your, say, admission. In the event you are admitted, we will encourage you to go to an NHIF accredited hospital or facility. This is just for quality purposes as well, so that we understand NHIF doesn't just accredit any facility. Once you're in an accredited facility, we believe you're in a place where you're able to get quality care.
Okay.
If whatever you have is a condition that can be managed from that end, we will take care of it from there. But in the event that you may need further care, we organize on how to bring you here.
Okay.
We partner with specific ambulances that are spread across Nairobi, across the country, that we organize on how to bring you over for further care. Well, in terms of outpatient, if it's something minor, we'll see how to go about it.
Okay.
If you incur expenses that relate to medical care, but we were informed, we normally just chip in straight ahead.
Okay.
Yeah. I don't know if there's anything I'm probably missing out, but in the event any of you out there have additional or further questions, we are available on social media.
Yeah.
Where you can reach us via telephone. I think we can highlight those numbers on our pages. You can walk into any RFH healthcare hospital and we'll be able to give you further information.
Yeah. So you guys have heard. I'm gonna leave the number to contact in case you want more information on Redleaf Medical Plan right here. Of course, director Dacheza Kamaye. And we are also gonna give you the social media handles. Feel free to ask. Uliza swali yote, hakuna mtu atakufungia mlango. We're here to help you out, and as well as follow our pages. Make sure you make proper use of the numbers as well. And karibuni sana with only 35,000, which is I think the most amazing and the most affordable plan that can be paid in installments. Walk into any RFH branch, Ruai, Ruaka, Tala, Embakasi, Jacaranda, Komarok, all those. Walk into any of those branches, Borania RFH, and get sorted. We need to secure and safeguard our futures, and just in case of an emergency, we never know about tomorrow, in terms of the medical stuff. So I think we've done amazing.
Yeah. Something most people don't understand is you'll do everything but forget about your healthcare.
Very vital.
Today we probably have insurances on our cars because it's a requirement, but we don't have medical plans, you know. In actual sense, if you do 35,000 per day, that basically translates to about 100 bob in a year.
Yeah.
Sometimes, say in a month, that is about 3K,
Yeah.
roughly.
Yeah.
Some people pay Wi-Fi more than that.
Yeah.
But in the event that you fall ill today, you're always just one sickness away from having to do fundraisings and being back to square one, you know. So it's something we really encourage people to look at seriously.
Yeah, and they say like taking care of your health is like guarding your wealth. So that will be my last remark. I think it's wise. Ngeka mhenga or something. All right, I'm out. Thank you so much for your time. God bless you. Make sure you follow us at Redleaf Medical Plan.